Hi, my name is Megan Dolan, and I'm going to be doing the the gastrointestinal, urinary, breast, testicular, and reproductive systems today. So today we have Shay. He's 5 years old. We're going to start with his abdomen. His abdomen skin color is consistent with his overall body skin color. It is smooth, no bumps, lumps, raises, rashes, red spots. His umbilicus is nice and midline. His nipples are symmetrical. And there's no abdomen distension noted. So you can see it's visible bilaterally, the rise and fall with each breath. And we have the 4 quadrants: right upper, lower quadrant, left upper, and left lower quadrant. So I'm going to go ahead and take my stethoscope and listen in all 4 quadrants. Okay, so he is positive bowel sounds in all 4 quadrants, and the percussions of general tones is peristalsis. So we're going to go ahead and do the percussion of the general tones now. So we're looking for tympanic sounds throughout the 4 quadrants, or the next couple places. So we're going to try to indicate and make sure that we have normal gastric movement. So I am going to go ahead and I'm going to listen for bruits. So again, I'm going to take my stethoscope and listen to the aortic. Okay, so no bruits on either side. So it's right above the umbilicus. We're listening for the renal, which is, right under the kidney, so on the right side. Okay, and then we're going to move over to the iliac crests, which is, or the iliac, which is right above the crests. And we're going to, okay, no bruits. And the femoral, which would be right here. Put this down here on both sides. Okay, so I'm going to go on the other side here. And I'm going to assess for the muscle tone in all 4 quadrants with a soft palpation at first. And then I'm going to go ahead and be a little firmer. Shay, any pain with that?
No.
Okay. So there's no bumps, lumps, no masses, no pain. He's not guarding at all. Okay. So again, the abdomen rises and falls with exhalation, and I palpated lightly and deeply with no guarding or grimaces. I'm going to check for any kind of dullness over the spleen or the liver. So I'm going to go on the other side here, and I'm going to palpate for the border of the lower bottom of the liver here. So I'm going to go to the right side of Shay's body here, right mid-clavicular line, and I'm going to. And it's non-palpable, but it's there. No pain, no tenderness. Okay, and then I'm going to go to behind to palpate the anterior axillary line for the palpate the spleen. Okay, so now I'm going to have Shay sit up, just like that. Okay, and I'm going to go behind Okay, Shay, I'll just have you take a deep breath and just sit up like that. Okay, so I'm going to go ahead and percuss the kidney for our costovertebral angle. So the 11th and 12th rib, sit up nice and straight for me, Shay. And I'm going to tap for tenderness. Okay, perfect. Okay, so Shay, I'm gonna have you turn towards me. Make sure you can see on the camera, perfect. So I have, sit up for me, Shay, perfect. We have Shay's chest area, so although he is a male, we're still gonna perform just a quick breast exam. So his nipples are bilaterally symmetrical. The nipples are the same, they're symmetrical, there's no indenting, there's no rashes, there's no raises, there's no lumps, bumps. We want to make sure to check the axilla. We want to look for any kind of rash or infection. The pigment is even. Okay. And if Shay were a woman, I will go ahead and give him some education on how to do the self breast exam. So Shay, I'm going to pretend like you're a woman. So if you were